Hello everyone, I'm Dr. Miriam. I'm a board certified family doctor, and in this video, we're going to discuss all you need to know about seasonal allergies. The term seasonal allergies is a bit of a misnomer because allergies can present year round and not just seasonally. It's also known as hay fever, or by its medical term, allergic rhinitis. Here's a breakdown of what we're going to discuss. First, we'll talk about the cause of allergic rhinitis, the symptoms associated with this, as well as how we evaluate patients, and then the treatments that are involved and why they work. To understand what causes seasonal allergies, we need to understand what a hypersensitivity reaction is. The thing is, our immune system plays a critical role in keeping us healthy by warding off foreign pathogens. However, the same system can lead to an exaggerated response to allergens in our environment, which is what leads to seasonal allergies. We refer to this as an exaggerated response because these allergens are typically harmless, and so the response itself is not meant as a form of protection. In fact, it really just leads to symptoms that can be quite bothersome to patients. If you're wondering what these allergens are, there are plenty of them, but we typically break them down into four major categories: pollens, insects, animal allergens, and molds. And going back to this concept of the hypersensitivity reaction, there are actually four different types, but we're going to cover type 1 because this is what's relevant to seasonal allergies. A type 1 hypersensitivity reaction is an immediate reaction and involves an antibody known as immunoglobulin E. All right, so this is going to get a little technical here, so bear with me. This is going to be relevant to what we discuss later on in the video. A type 1 hypersensitivity reaction involves a step known as sensitization, and this is what occurs when we're first exposed to an allergen. Our body produces immunoglobulin E antibodies that are specific to that allergen. So, what happens when we're exposed to that allergen again? Well, these immunoglobulin E antibodies actually sit on the surface of immune cells like mast cells and basophils. So when we encounter that allergen again, the allergen will bind to those immunoglobulin E antibodies, triggering a process known as degranulation. This leads to the release of inflammatory mediators, of which histamine is one of them. Keep histamine in mind because this is going to be relevant to the treatments that we'll discuss later on. When this happens, this leads to the symptoms that we know and love, including sneezing, runny nose, usually with clear discharge, itchy eyes, nose and throat, watery red eyes, postnasal drip, coughing as a result of the postnasal drip typically, and then sinus headaches. Aside from the symptoms themselves, we can also look for various findings on examination. This includes an allergic crease, which is basically where you have a crease on the bridge of the nose that occurs from excessive rubbing. Another finding is known as allergic shiner, and this refers to the dark color under the eyes that are caused by long-term nasal blockage and swelling under the eyes. So yes, unfortunately, allergies can actually be a cause of under eye circles. Another thing we can look for is something we refer to as boggy turbinates, which is basically where these nasal turbinates that you can see here appear swollen and engorged. And we can see this when we look up a patient's nose into their nasal cavity. Aside from these findings, allergy testing can also be part of the diagnostic workup, but it doesn't necessarily mean that every patient needs to get this done. We typically reserve allergy testing for patients with severe symptoms so that they know what the trigger is and can try to avoid it as much as possible. So, how do we treat allergic rhinitis or seasonal allergies? There are actually a lot of different treatment options available, but let's start with the non medical options first. Non medical options really involve trying to limit exposure to the allergen. So, for example, in the case of dust mite allergies, patients can opt for dust mite proof covers or allergen impermeable covers on their mattresses and pillowcases. In the case of an allergen to pollen, patients can use an air purifier inside the home, vacuum their carpet once a week, and avoid wearing their day clothes to bed. Let's now move on to medical options. One of the options which is readily available over the counter is a nasal saline spray. And this basically works by rinsing out the nasal passages so that you can get rid of the allergen. The second is the glucocorticoid nasal spray, and this is the most effective treatment option for allergic rhinitis. It's particularly effective in treating nasal congestion, which often does not respond very well to oral antihistamines, which we'll talk about next. Glucocorticoids are a synthetic version of cortisol, which is a hormone produced naturally by our adrenal glands. It has an anti-inflammatory action, so it works by reducing inflammation inside our nasal passages. Our third option is our oral antihistamines, which counteract the effect of histamine, which is the inflammatory mediator that's released as part of that type 1 hypersensitivity reaction. So that's how they work. There are first and second generation oral antihistamines, but the second generation ones typically cause less drowsiness, and these include cetirizine, loratadine, and fexofenadine. Antihistamines also come in the form of nasal sprays, one of which is azolastine, but these tend to be less effective than our corticosteroid nasal sprays. So these three options are some of the most commonly used treatments for allergic rhinitis, but let's talk about some less commonly used options. The first is cromolyn, which works by stabilizing mast cells, preventing the release of histamine. So in a sense, it's similar to our antihistamines, but it has been shown to be less effective than our oral antihistamines as well as our corticosteroid nasal sprays, which is why those two are more commonly used. Our second treatment option, which falls under this category, is ipratropium, which is an anticholinergic. This basically works by counteracting the effects of acetylcholine, and so it helps reduce mucus production. Ipratropium comes in the form of a nasal spray, but because our glucocorticoid nasal spray is already so effective, it tends to be the preferred drug. Let's now cover another treatment option known as desensitization. If you recall from our earlier discussion of type 1 hypersensitivity reactions, there was a step known as sensitization. So desensitization is basically the opposite here. It's a form of immunotherapy that involves exposing the patient to gradually increasing amounts of an allergen extract. The goal of this treatment is to modify the immune response altogether so that patients become less sensitive to the allergen, leading to a reduction in symptoms or clearing them up altogether. We typically reserve desensitization for patients who have really severe symptoms or can't avoid their trigger altogether. All right, everyone, hope you found this video helpful. If you did, make sure to like and subscribe for more content like this.